Welcome back, future nurses. I'm Dr. Kathleen Jude Estime, and today we're diving into cardiology for the NCLEX. We're going to prepare you and we're going to give you scenarios, and this is an essential area for every nurse to understand. And just remember, whether you're studying with Professor Leandre's NCLEX coloring books, digital products, or joining our tutoring sessions, you're building confidence until you pass. Okay, Professor Leandre, here's question 1. It's about critical thinking and safety. Here's our first scenario. A client presents with chest pain radiating to the left arm and shortness of breath. What's the nurse's very first priority action? Should we perform an EKG, administer nitroglycerin, or assess vital signs?
Pause and think. Should we perform an EKG, administer nitroglycerin, or assess vital signs? Always remember, client safety is priority 1. Chest pain can signify a life-threatening condition like a myocardial infarction, requiring immediate assessment and intervention.
Professor Leandre, here's question 2, therapeutic communication. A client diagnosed with heart failure says, "I'm scared I won't make it through this." Which response is the most therapeutic?
We don't downplay their fears or offer empty reassurance. We validate their feelings and encourage them to share more. So, therapeutic communication in cardiology. Responding with, "It's completely understandable to feel that way. Would you like to talk more about your concerns?" can establish trust and rapport.
Here's question 3, Professor Leandre. It's on medication. Your client with hypertension is prescribed lisinopril. What lab values and side effects should the nurse monitor closely?
Think renal function, potassium levels, and signs of hypotension. Medications frequently show up on NCLEX. Monitoring for elevated potassium levels and signs of dizziness will ensure medication management.
Here's question 4. It's on delegation and scope. When caring for a client post-cardiac catheterization, which task can the RN safely delegate to an LPN or CNA?
RNs can handle assessments, teachings, and complex interventions. LPNs can monitor vital signs, and CNAs can assist with basic care. Delegation is vital in nursing. If you're unsure, think about what tasks require critical thinking versus routine care. And remember, I can cover this extensively in my tutoring sessions.
Complication scenario. A client with a history of coronary artery disease suddenly becomes diaphoretic and confused. What's the best first action for the nurse?
Assess the patient's vital signs, perform an ECG, and notify the healthcare provider. Always prioritize assessment when a patient shows sudden changes in condition. Timely intervention can be life-saving.
Okay, Professor Leandre, here's question 6, patient education. A client with newly diagnosed atrial fibrillation asks about the importance of anticoagulation therapy. How do you explain this?
Emphasize the risk of stroke and the role of the anticoagulant in reducing this risk. Patient education is crucial in cardiology. You might say atrial fibrillation can lead to the formation of blood clots that increase the risk of stroke. Anticoagulation helps prevent this by thinning the blood.
Here's question 7. It's about lifestyle modifications. What lifestyle changes should you discuss with a client diagnosed with heart disease?
Think about diet, exercise, and smoking cessation. Discussing lifestyle modification is essential. Recommend a heart-healthy diet, regular physical activity, and smoking cessation to improve heart health and overall well-being.
Listen, if you found these questions helpful, don't stop here. You can grab Professor Leandre's NCLEX cardiology coloring book, download digital study guides, or sign up for her tutoring.
My NCLEX review program includes weekly TikTok lives and Sunday Zooms, and you stay with me until you pass. Visit my link tree in the bio to get started. See you in the next episode, and remember, you got this.